You did it?
Thank
Oh,
you.
okay, there
Oh,
we
yeah,
go.
I was asking.
Yeah, yeah.
Um, I felt like I hit the things I wanted to hit. But the mosaicism thing, testing mom was just that was as soon as I said it, I was like, that's not right. And I felt like the order was just a little clunky. Like there were parts like when I brought up the resources, I was like, that should have been at the end. So there's like a couple things where I was like, this doesn't feel quite right. But
Yeah. Sorry, you just froze. So
oh
overall, you said the talking about testing mom, and then it just felt a little clunky.
yeah, I think
Okay.
also like there were a couple psychosocial points that I was trying to like the when you said your mom committed suicide, I was like, I didn't want to like not address it, but I also didn't want to like harp on it. So
Mhm.
that was I felt like I didn't know how to handle that one.
Yeah, and this is your first time like fully doing a full-on thing by yourself, so that's okay. That's definitely something that is hard. Just the more you interact with patients, you'll have more like understanding of how to respond to those kinds of things because it is hard. But yes, definitely like probing more into that. And then for the trisomy 18 on mom, yeah, that's just you trying to cover all your bases, but yeah, typically we wouldn't think that we would want to get chromosomes on mom unless it was like um something weird came back. Like sometimes like if you think of sex chromosomes, if something came back interesting, like that's more of a time, at least in my mind, where something could be coming from mom, but not necessarily with trisomy 18, but that's okay
That's
because
why I
you
was thinking about it because I just saw a Klinefelter's NIPT in clinic and I was like, oh, she said test mom. And then I was like, different.
yeah, no,
Yeah.
that's okay. That's completely okay. And so if we just go through it from beginning to end, I'm trying to think of everything because I'm supposed to give you like feedback, right? Which I'm happy to do. So overall, I think you did a really good job explaining things to me. And just yeah, like not giving too much detail that I would get more confused or overwhelmed, but I thought your explanations were really nice. And I think generally, I know you said it felt a little clunky, but I think your overall flow was fine. I know transitioning from one thing to the other can be difficult, but like as a patient, me trying to put myself in the patient view, like I didn't feel that way. Um, a couple of things for um, like more technical. I know you talked about PPV, so that's good. And you clarified that because I know that's what Crystal wanted you to do. So that was good. Sorry, I'm thinking out loud as I'm talking to you because I couldn't like write stuff down. So in the beginning of the session, you did a good job like talking about what we were going to go over today and everything. And then asking like what I knew from what the doctor told me. So those were all really good. One thing that I've had to work on myself is when you set the agenda, like being a little bit more concrete with it. So, I know you said we're going to go over those test results in trisomy 18. Um, I can't remember exactly everything you said, but maybe just being a little bit more like direct with it a little bit, saying like, we're going to go over those results, what those mean. We're going to talk about next steps and options that we can have for you. And then at the end, I'm just going to get some more information about you and your family to make sure we're not missing anything. Just to sort of like break it up a little bit.
Mhm.
I find that helps patients a lot. And you did it, but I feel like you could just make it a little bit more precise. But that's just me. So you don't
No,
have to
that
listen.
makes sense. I feel like
Yeah.
I have a habit of asking too, like, do you want to move into this? And it's like, just,
Yeah, so
just like,
that's so normal because whenever I first started out too, it's like you're asking, you want to engage the patient and you want to ask them like, hey, like what how do you feel about this? But then technically a lot of times like in the beginning you ask those questions, but you haven't explained anything yet. So then the patient's like, well, I don't know what you're talking about. Like, I don't know what you mean, like get started on what. So
yeah.
like, yeah. But that's okay because that's a normal thing. And with time, that's just gonna become easier for you. So don't worry about that.
Okay.
Um, and then going into talking about trisomy 18, um, I think your overall explanation was good. When you brought the visual aid in towards the end, I think you could start with a visual aid. Because I said I was familiar with genes, but not really chromosomes. So I think honestly, in that situation, just being like, I'm just going to give a brief overview of just what we mean when we talk about genetics, and then just bring up that visual aid right then, and maybe show a normal one, and then have a slide with the extra 18. Um, and also everything I'm saying, like I know this is recording, but anything I'm saying, like if you don't agree with it or you don't like it's not your style, that is okay. I am also just a student still, even though I'm about to graduate. But um, so I think bringing in the visual aid first would be helpful, just to give a little bit more context. And then because you covered all of like the educational aspects, but just the when you put them like in chronological order, because at the end you talked about how, we get one chromosome from mom and one from dad, and that gives us the pairs. You talked about that at the end
Hmm.
rather than the beginning because I'm just trying to think in a patient's mindset, like when you're talking about the chromosomes, like where like where do they come from kind of thing, like what,
Yeah.
you know what I mean? So I think just talking like this is what genes are, which you talked about. This is what chromosomes are. You did a great explanation of that. And then from there saying, and we get one from mom, one from dad. And this is what gives us these 22 pairs. And then our 23rd pair, like you explained, tells us the sex of the baby the sex of the baby. And then saying sometimes there can be extra chromosome material. And this is when we see like conditions like trisomy 18, which is what your test result came back with.
Yeah, I
Um,
was thinking as I was doing it, like I started off talking about like I was like, oh, okay, I'm gonna move into talking about what trisomy 18 is. And then I'd like put the cart before the horse already. So I see what you mean. Like you have to kind of give the
yeah.
background before.
Yeah,
So
and
yeah.
that's normal. So, and like I said, you gave all the information. It's just a matter of the order. So talking about all of that and then saying in your test result came back with trisomy 18, and then using that as the segue to talk about cell-free DNA testing, because your explanation of that was really good. Like talking about comes from the placenta, um, and that's what we're looking at. So just using that as a segue. So it's like, okay, yeah, your test result came back with trisomy 18, and the testing you had done is looking at the chromosomes to see is, like you said, if there's extra or missing like chromosome material. So just using that as like more of a chronological, I guess you could say, process,
Mhm.
um, probably will just help patients like follow a little bit better.
Yeah.
Um, but your explanation was really good for the cell-free DNA. If you want to use the visual aid for that, you can.
Yeah.
But it's also hard over telehealth. I usually like to draw it out whenever I explain that to patients, but um, so that was good though. And then you talked about PPV, and I asked you a clarifying question and you answered it great. So good job. I hope I wasn't a difficult patient,
No.
but okay. So that was good. Um, and then you talked about features associated with trisomy 18. So when you were talking about the choroid plexus cyst, you eventually told me what it was, but not all patients are going to know what that means.
Mhm.
Uh, and I'm just telling you this because I've made the same, it's not necessarily a mistake, it's just a learning thing. Like in the beginning of my first prenatal rotation, I would talk about stuff and not explain it. And that just comes with time, but not every patient's going to understand what a choroid plexus cyst is.
Understandable.
Yeah, so saying, yeah, they saw that on your ultrasound. It's a filled sac. We're not concerned for it causing issues with baby, but it is, just like you said, something that increases our suspicion of trisomy 18. That was great. And then going into, you talked about other features. I think starting with other features on ultrasound that we could be looking for, and then going into other things that we might see like at birth and prognosis and all of that. So, um, yeah, but you talked about all the information really well, and you validated, like, I know this is a lot of information to comprehend right now. It can be like, I know it's probably very difficult for you having other like two other children. So those were all good things too.
Cool.
Mhm. And then talking, sorry, I'm continuously just going through my mind. So then we talked
For sure.
about prognosis for patients. Yes, 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 yes. This is getting, I'm thinking, I'm trying not to think about like getting too nitty-gritty because that's not necessary. But just to tell you for like in your what specialty are you doing for your rotation in the summer?
Pete's.
Pete's? Oh, I did Pete's. Okay, so fun.
Oh, fun.
Yeah, so I can just see like maybe a supervisor saying this, but also trisomy 18. I've seen this like a couple of times when patients are like, well, I looked up online and like there's kids that are living past 1 year. And typically those scenarios are like mosaic trisomy 18. Um, so that's like really like getting in the weeds. So I wasn't expecting us to talk about that anyways, but just for me to tell you for future reference, in your prenatal rotation, that is something that could come up, and that's when you could talk about those children typically have mosaic trisomy 18. Not all of their cells are affected with that extra chromosome material, which may lead to like a less severe or less severe presentation of the condition, but majority of the time, babies with full trisomy 18 do not make it past the first year of life.
Okay. Yeah, I had that down to talk about, but I guess it probably isn't something you need to bring up unless like the patient really wants to know, right?
Yeah,
Okay.
and yeah, unless they bring up, I mean, it's just depends on your supervisor and your own preference, but if the patient was like, "Well, I saw kids online that are living with this," then I would bring it up. Sometimes it's helpful just to mention in case like the amnio comes back and it is like mosaic, but um that's super nitty-gritty, so
Okay.
don't worry about that. Um, and then in terms of, I liked how you talked about referrals, of, making sure that the patient's going to be supported at delivery and everything like that. Um, in terms of options, I also don't expect you to talk about this yet either, but termination is also an option.
Hmm.
So, talking about, you talked about referrals, making sure that at delivery and at birth, we have people there to make sure baby's okay. Um, and then you could probably like sometimes you'll get more comfortable, but comfort care, explaining what that is, like maybe not wanting to have like life-saving measures be done, whatever.
Hmm.
But yeah, just mentioning termination. You don't even have to say
Yeah, I
termination
completely see that.
thing. Yeah, no, that's okay. And you can something like I prefer to say like some individuals once they know like if this is for sure a condition that their baby has, some individuals may not want to continue the pregnancy. And those are options that we can talk about.
Okay.
And then
Make it a little
depending on,
softer.
yeah, and then usually the patient guides you in terms of how they're feeling with that. And then also depending on what state you're in, as we know, it's going to impact all of that. But that's further down the line. But just to mention it, because that is an option that's available to them. But
Mhm.
so those are all good. And then we talked about, and then we went to family history, right? Yeah.
Yes, yeah.
Okay.
Well,
So
we talked about
amnio.
diagnostic tests.
Yes. Okay. So yeah. So you got it at the end. Because this happened to me in my first prenatal rotation. You have to talk about the specific testing that they're going to do with the amnio.
Okay.
So talking about fish and the karyotype, which you got at the end, so no worries. But I've forgotten to talk about that before, and that's feedback that I've gotten. So just talking about that when you're talking about the amnio, just so it's not like split up like that. But that's something easy that you can fix, and I've done it before too, so no worries.
Okay.
But yeah, talking about the specific, and I like to think when you're describing fish, because I know you said preliminary results, that makes sense. But if a patient asks more about like what does that actually mean, I like to say it's like a fishing rod. So we're looking just based on like the first, I don't, it's hard to explain. I say like this first test is looking just to see is there an extra 18th chromosome anywhere in the sample? And then that's going to give us that preliminary information. But then the second test result is going to be, just like you said, that picture of chromosomes that will for sure tell us if that whole 18th chromosome is present, the extra or the third one. But yeah, so just putting that when you're talking about diagnostic.
Okay.
But
Yeah,
yeah,
that makes sense.
you described it well too. Sorry, I'm just thinking of everything, and if I'm being too nitpicky, please tell me to shut up.
I want
But
to hear like all the details so I know like just what to keep an eye
yeah,
on.
because also just from my experience, because I was nervous for prenatal, so it's okay.
Definitely
Um,
am.
it's honestly not like once I'm gonna tell you like the transition from first to second year, like being in clinic and like doing all of this, you're gonna feel so much better. I know right now it probably feels like I don't know what to do, but like it helps so much being in clinic. You're smart, you got this. Everyone learns. But for amnio, just mention that it's ultrasound guided. That's my personal preference, but
Oh
that's when I
yeah.
was asking like, how do they know that they won't hurt baby? Just saying that they have an ultrasound, like, and I liked how you said our MFMs are really good about that they have a lot of experience with that test. So just saying it's ultrasound guided. Um,
Yeah, I didn't even think about that, but that makes sense how that would be like
yeah, just because
reassuring.
patients might be aware, yeah. You talked about the miscarriage risk, which was good. Um, and then this is something, again, nitpicky. You'll learn about it in your prenatal rotation, but just saying like has Jessica talked to you about what to expect after the amnio, like what it feels like or what to do afterwards?
Not really. I don't think so.
Okay, so then that's not, so basically, usually we describe it as a really strong menstrual cramp because a lot of
Okay, she
patients
did
are
say
nervous, like
something. Yeah.
if it hurts or whatever, and just saying like everyone has a different pain tolerance. We generally recommend for like the next day or like the next 48 hours, you take it easy, don't lift anything heavy, no intercourse. If you have any like significant bleeding that's abnormal, call the office, blah, blah, blah. But that stuff you'll learn as you go on.
Okay.
Just me spewing information that you probably haven't learned about yet. So sorry.
Well, I mean, I'm gonna hear it from a supervisor or from you, so it's better to hear
Yeah.
from you.
Well,
So
yeah. So, yeah, that's why I'm like, I know where you're at. So yes. So, but overall, good. I promise you. I really liked all of your explanations. And then in terms of family history, I sort of messed up a little bit myself. When you asked about siblings, I talked about my full brother. I did have two half sisters, but I didn't tell you that. So that was on me. Did you ask me same mom, same dad for my brother, for the brother? It's
I
okay.
didn't.
You
No.
did. Okay, so then I mean technically then you might miss those half, but that was
Yeah.
also on me. I could have just said that. Um, but yeah, so for the family history, prenatal it's hard because it probably feels really vague, like I don't know what to talk about kind of thing.
Yeah.
Because the targeted questions are harder than in cancer. At least that's how I felt. So you did a good job on clarifying father of pregnancies, because there were two different fathers. Um, for the dad that I had my two prior daughters with, he passed away, in a car accident. We were all in the car accident, but he passed away. We were hit by a drunk driver. That was the information that I got.
Okay.
So, but I mean, those are points that I think she just included to have more of a psychosocial
Okay.
conversation. But yes, so he
So
passed away.
do you typically ask about like if it's not the father of the current pregnancy, would that be applicable? Like would I normally ask in a session about them?
Um, yeah, I would say because I mean, so it sort of ties in because you asked, okay, I have two previous daughters, and I'm pretty sure you asked me like, are they doing well? And I said yes. So there wouldn't be too much concern, but you would still want to know just like how old the dad is or if
Okay.
they're still living, just to have like for completeness.
Okay.
But I mean, you wouldn't have to go into their family history or anything like that.
Okay. Just like know like
I'm
the basics about him.
Yeah, just to know because for example, if one of my daughters had like something going on, then you would want to know, is the dad living, or if he has any conditions because, or any medical concerns, because if it's something genetic, is it coming from him or is it coming from me, kind of thing, if
Yeah.
it were hypothetically.
Yeah.
But
Okay.
yeah. And then so when you did a good job asking about any intellectual disabilities and all of those things. We're instructed to not give you any extra information unless you ask specifically. So my brother, I said he had mild intellectual disability. And then you asked, like, is he able to live on his own? And I said high functioning. He also is diagnosed with autism spectrum disorder. Um, but I mean, I could have disclosed that, but then I was like, I don't know. So I just didn't say anything. But so that's one thing that you can sort of ask overall for both like sides of the family. Anyone with any, you said intellectual disability, which is good, or any other diagnoses or genetic conditions, that kind of thing.
Broaden the net a little bit.
Yeah, yeah. And I think in the prenatal Prisma sheet at the top, doesn't it say ASD? Do you have that with you
Yeah, I have it with me.
in the top
Oh,
boxes?
it's in, yeah, so it's like ID/DD/LD/ASD
Yeah.
in there. Yeah.
Yeah, no, that's okay.
Um,
Just something to think of.
I guess like
And
if I ask about them, just lump them together and ask them
yeah,
together.
usually
Yeah.
that's what I do. And honestly, in the real world, like when you ask about that, patients are probably gonna be like, oh yeah, my brother has intellectual disability, also has autism.
Okay.
But I just we're told not to like give more
Yeah.
than that. But um, so that was good. You did a good job clarifying. I like how you ask the follow-up questions for him. And then for mom, I know it's awkward to when someone says something like suicide. Um, Sometimes just asking follow-up, depending on how the patient is, just seeing like how old was she when she passed away? Was this something recent or did it happen a long time ago? Um, and just saying like, I'm really sorry to hear that. And then you'll be able to tell by the patient if they want to talk more about it or not. Because I mean, at the same time, there's only so much you can say, and then just moving on.
They ever
Um,
get like upset that you're like crying about it, or they just assume like, oh, they're a medical professional, like they're gonna ask
I
the
think it depends on the type of question that you ask for follow-up. Be like, usually if it's suicide, I say like, I'm really sorry to hear that. Like, um, how old was she when she passed? And then just gauging that because so for if I'm Kendra, my mom passed at 35. So it was like over 20 years ago.
Okay.
Because did you hear that?
No.
My fire alarm? Someone's fire alarm's going off.
Oh,
Anyways, not mine, so it's
okay.
fine. Sorry. But yeah, so she passed at 35. So I don't know. I can't do the math, but basically that was a long time ago, I'm assuming, if my dad's 30, I'm 55. But she also had other psychoactive substance abuse that she was diagnosed with at 15 years. So basically, like the family history there was that she had substance use disorder, and that's what ultimately led to her committing suicide. Um, but overall, did you ask about grandparents?
No, I wasn't sure if I need to go that far back since it's like we're starting with baby, right?
Yeah, so
But do you
that's something
normally go?
that I've had issues with, but you do go to the grandparents.
Okay.
So
Okay.
just asking, are they living? Are they not living? So they were both deceased, no medical conditions known. Um, and so at the end, I liked how you asked, like, overall, any other conditions that we should think of when you talk about genetic conditions, and you said like sickle cell or cystic fibrosis. I know it's for the pedigree that you have for Prisma, that's like clinic specific usually, like where I'm at right now, they don't have that on there. But just asking overall any genetic conditions that come to mind. Example, sickle, like, and being more relevant. So like if I'm Caucasian. What's more prevalent in the Caucasian
Yeah.
population? Cystic fibrosis. So maybe using that one first, or just saying both and seeing if they recognize one, which you
Okay.
did. And
I
I
gave
said,
a
oh,
horrible
I've heard of, yeah, but
I gave a
that's,
horrible description of the sickle cell though. I did it and then I was like, I didn't tell her anything.
no, it's okay. It's okay. But yeah, so if you say like any history of sickle cell disease, if the patient doesn't know, they're going to be like, I haven't heard of that. So
Okay.
just giving more context there, but that's something that comes with time. Um, and then overall, when you asked intellectual disabilities or those kinds of things, just asking overall anyone else in the family with any like substance use disorders, mental health conditions, genetic conditions that come to mind. That's usually something that at least at Prisma I would ask at the end, like overall.
Okay.
And then that's how you could probably catch the substance abuse in mom.
Okay.
Um, because the family like history that Crystal gave us was um as both sets of grandparents were no so Kendra, this is what it says. Kendra's parents were only children and did not speak about their parents, as both sets of grandparents went no contact after Drew's autism diagnosis, blaming Kendra's mother's substance abuse for the condition.
Okay.
Um, and then like when you asked about prenatal vitamins and medications, that was all good. But the reason I wasn't taking prenatal vitamins was because I was afraid of developing an addiction like my mom.
Okay.
Um,
Yeah, I missed all those psychosocial points.
yeah, but that's just also something that does come with time. But yeah, just that can be something that you probably like, oh, has your doctor did they prescribe you prenatal vitamins or did it not work? Like just gauging why
Mhm.
sometimes without being like, why aren't you taking prenatal vitamins kind of thing.
Yeah, not being like
Um,
accusatory.
yeah. So that could just another psychosocial thing, like because if she were to say that to you, then you can clear that up and say, like prenatal vitamins, they're not something that we typically think of that we'll have addictions to. These are just like supplements that can help make sure that your body's doing well and like blah 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 blah. But overall, that was the only thing for those were the things for the family history. I hope that didn't sound super overwhelming.
No, the family history is one of those that I feel like I'm still working on. Like it's just hard for me to hit all the points and like remember. So I
Yeah.
think once I start doing it like, every day in clinic, hopefully I'll just get used to which things I need to ask. But
Yeah, because
yeah.
you'll get more into the groove of like after you take like everyone down, anyone diagnosed with any mental health, substance abuse or genetic conditions. And then I could have been like, oh, my brother was diagnosed with autism at 3. And then like, oh, has he ever had genetic testing? No, he hasn't. And
Okay.
that kind of thing. So because I don't think because whenever I did this um last year, ours was Fragile X, and I don't believe I didn't see Fragile X anywhere in here because I mean like mom has psychoactive substance use disorder, but like that doesn't necessarily correlate. But the only other thing, ask where dad's ancestry is from, and then consanguinity. But other than that, that was it. So,
Okay.
and
Cool.
those are all very minor things that'll just come with time. Like as you're getting used to it, like we ask patients this, oh wait, you did ask me that. Sorry, you did
You're
ask me that.
good.
Sorry, I'm literally losing my mind. But yeah, no, overall, and I didn't, if you felt nervous throughout it, I didn't get that impression
Okay.
as a
That's
patient.
good. This is
Uh
the part that I always feel most nervous with, so I'm glad that it's not showing.
that this is the part that you feel most,
The
what did you
family history, for some reason, I just like, it makes me nervous because I always feel like I'm missing some component. Like every single time I've done a role play, I just miss like something every time. So
Mhm.
but I mean,
And yeah, go ahead, sorry.
yeah, eventually I think I'll get used to it. So,
Because yeah, you'll get used to, okay, because the way that has helped me is like generation by generation. Okay, do you have other children? Same dad? Not, yes. Get all the information there. Just saying any medical concerns from them, anything that they've had to deal with their whole life. That's the other part. Because prenatal can be so vague, but being like anything they've dealt with since birth, any that kind of thing. You talked about oh yeah, birth defects, minor thing. You could say birth differences.
okay,
Um,
yeah. make it a little
It,
nicer.
yeah, that's just preface. Like some, I've been with genetic counselors that say birth defects. I've been with other ones that say birth differences.
Okay.
Just depends. But yeah, just going generation by generation, covering your bases, and then overarching, grouping those questions typically at the top of the pedigree is the feedback I've gotten from supervisors that helps just speed it up a little bit more
Yeah.
rather than asking, because that's what I used to do. I used to, every single person, any history of XXXXX. Okay. Other person, any history of XXXX. And they're like, you need to clump those together better. And that's something you learn with time. So yeah,
Okay.
it's there. But it'll come more natural once you get used to it because you'll get in the habit of, okay, say mom and dad is you, yes, no, and then go from there. Are they healthy? Yes. Do they have children? Yes. All healthy? Yes. And then it's just yeah, but you did good. Don't
Okay.
beat yourself up. You did good. You explained everything that you needed to, just missed a couple of little things, but I missed things in my role play too, so you're fine.
Okay. Cool.
Mhm.
One question. I wasn't sure for referrals, like, would I talk about, like, would I say I'm making the referrals now if they haven't gotten the amnio back yet? Like the karyotype and fish back results back yet? Or would I say, like, I'll make those once we get results?
I would say, just thinking about what I've said before is I think that's when you could talk about like why individuals do diagnostic testing and saying like with that result, if you're interested in doing this, then we know what to expect at birth and we can have specific medical professionals there. And we know that once baby is born, we would want them to see pediatric cardiology, so on and so forth. Like if they had no like gastrointestinal issues. I would talk about that after, yeah.
Okay.
Um, after explaining amnio and saying, depending on the results, we might want additional medical providers at the delivery. And then, yeah, just you don't have to go in. This is just me, but I don't think you have to go as in depth as you did talking about the specific referrals. Just sort of gauging like we can refer to other like pediatric specialists to be there.
Okay.
Depending on the like if baby, let's say I was having like a baby boy Brian will tell us what he needs when he's born or whatever. So
Yeah.
does that answer your question?
Yeah, I wasn't sure about like how to go about that in this or like where it would
Mhm.
fit in. So that makes sense. Just to talk, kind of mention it
Yeah,
after
just
the
I think
amnio.
after diagnostic testing, because I don't know necessarily if I think you can I think we can place those referrals. But I don't think we would unless more ultrasound findings came up or we had a definitive diagnosis because like if there's no heart defects right now, we're not going to refer them.
Yeah.
But as the pregnancy goes on, being aware of those. So,
Okay. Cool.
mhm. Yeah.
Well, thank you
Any
so
other
much.
questions? Yeah. You feel okay?
I think
Don't.
so. Yeah, I
Okay,
think it
good,
just
good.
like I'll get more comfortable with it
Yes.
and kind of refine those things as I go. But
Yeah, no,
um,
definitely. I just
those all made
asked
sense.
because, yeah, I just asked because I know after mine, I was like, so don't feel like that.
Yeah, no, I feel like every single like role play, I'm like slowly teasing out like how to say things. So I'm just banking on the
Yeah,
fact that with time,
you will. I'm not kidding. Like, it's so, at least for me, it was so helpful being in clinic because you're observing other people talk about it. You're doing it every day, especially in the summer. You're doing it 5 days a week. So, um, you'll you'll look back and you'll be like, "Oh my gosh, I've grown so much." So, it's a good thing. And you're at a great starting point too.
okay.
So,
Well, I really appreciate your critiques because I like knowing just like nitty gritty things to keep in the back of my mind. So, and
yeah.
some of the bigger points too. Like, yeah, it was helpful to just kind of like walk through it, especially like start to
Yeah, of
finish.
course.
So,
Yeah. And if you like coming, I know you might have to do a prenatal, you're probably gonna have to do a prenatal session in May.
yeah.
If you want to practice, if you have any questions, I know Caitlin's your base pair, but if you have anything, you can always like tell everyone in the first years. They can always text me if they have any questions, want to practice, whatever, because I remember being nervous and all of that. So I'm happy to help in whatever way.
Thank you.
If I'm helpful, who knows? But
No, very helpful. Those are
okay.
definitely like because everything you're saying made perfect sense. I just like didn't think of it at the time. So
And it's
Yeah.
a lot to think about. That's okay.
Mhm.
It's okay. It'll come. It'll start to stick more. So
I'm thinking like muscle memory. Like, yeah.
it literally is like you'll come down like after doing a couple like of the same indication, you're gonna have your spiel and you'll learn how to like just like alter it or adapt it a little bit based on each patient that you're seeing. And yeah, it's a good feeling. You'll get there. Don't worry. It'll.
Okay. Well, thank you. And thank you for your time because I know that you're probably super busy. So,
Well, today, thankfully, I had off from clinic, so that's why I asked to do it today because the next 2 weeks I'm there all 3 days. So
oh
yeah.
goodness. Okay. Good luck.
Yeah. Well, thank you. Thank you. Are you in the student office or are you in
Yeah. I'm in the
nice? Did
student
they
room.
take where are you where's the zebra painting?
Behind my home.
Oh, I was like, I couldn't tell where you were. I was like, oh, okay. That makes
Yeah.
sense. All right, yeah. Well, do you have class at 1?
No, we had our lecture yesterday for it was like the oh God, what's it called? Dysmorphology one.
Did you have it with Wesley?
Yes.
Ah,
It was
nice.
great. Apparently I have low set ears. I was like, oh cool. Yeah.
Yeah,
I
he did
also
it.
have the palmar crease. Like,
Ah,
yeah.
yeah, very fun. I know. Did he do the Gower maneuver for you guys?
No, did he do that for you?
He got on top of the table and did it. So that's how we remember him now. Yeah.
Oh wow, he didn't do that for us.
Yeah, good old us. Yeah, he's fun though. He was really nice.
He's a trip. He was like quintessential Clemson person. Like when he said he went to Clemson, I was like, that makes so much sense.
Yeah, that's what Caitlin said too. Yeah, I
Yeah.
know. Like, okay. But all right. Well, I hope you have a good rest of your day and I will see you at CaseCon.